CNA Practice Test 2026 Certified Nursing Assistant Infection Control Exam Questions and Answers. Question 1. What is the most effective way to prevent the spread of infection? Wearing gloves, using hand sanitizer, hand washing with soap and water, wearing a mask. Hand washing is the single most important practice to prevent the spread of pathogens. Question 2. When should a CNA wear gloves? When feeding a resident, when coming into contact with body fluids, when making an unoccupied bed, when walking a resident. Gloves are part of standard precautions and must be worn when contact with blood or body fluids is possible. Question 3. What is the correct order for removing PPE? Gown, mask, gloves, gloves, goggles, gown, mask, mask, gown, gloves, goggles, gloves, mask, gown. Gloves are usually the most contaminated and removed first, followed by goggles/shield, gown, and mask. Question 4. What are standard precautions? Only used for patients with known infections. Used for all patients regardless of diagnosis. Only used in hospitals. Wearing a full hazmat suit. Standard precautions apply to all patients to prevent the transmission of infectious agents. Question 5. Which link in the chain of infection is broken by wearing a mask? Portal of entry, susceptible host, source, mode of transmission. Masks protect the nose and mouth, which are common portals of entry and exit. Question 6. How long should hands be lathered during hand washing? 5 seconds, 10 seconds, 20 seconds, 60 seconds. CDC recommends scrubbing hands for at least 20 seconds. Question 7. What does sterilization mean? Reducing pathogens to a safe level, cleaning with soap, killing all microorganisms including spores, using hand sanitizer. Sterilization is the process of destroying all forms of microbial life. Question 8. Which of the following is a bloodborne pathogen? Influenza, hepatitis B, common cold, tuberculosis. Hepatitis B, C, and HIV are primary bloodborne pathogens of concern in healthcare. Question 9. What should you do if your gloves tear during a procedure? Continue the task. Put a second pair over the torn one. Remove gloves, wash hands, and put on new gloves. Tape the tear. Compromised gloves must be replaced immediately after proper hand hygiene. Question 10. Where should used sharps be disposed? Trash can, biohazard bag, puncture-resistant container, recycle bin. Sharps containers are specifically designed to prevent needle sticks. Question 11. What is a nosocomial infection? An infection acquired in a healthcare setting. An infection caught from a family member. A foodborne illness. A genetic disorder. Nosocomial or healthcare-associated infections, HICE, are acquired during treatment. Question 12. A resident has C. diff. What is required? Standard precautions only. Contact precautions and hand washing. Airborne precautions. Droplet precautions. C. diff requires contact precautions. Hand washing with soap is necessary as sanitizer doesn't kill spores. Question 13. Which of the following requires airborne precautions? Strep throat, tuberculosis, influenza, MRSA. TB is transmitted through small droplets that remain suspended in the air. Question 14. When using an alcohol-based hand rub, you should rub until 10 seconds have passed. Your hands feel sticky. The hands are dry. You reach the resident. Hand rub must be rubbed until completely dry to be effective. Question 15. What is the portal of exit? Where the germ enters the body. Where the germ leaves the reservoir. The person who gets sick. The location where germs live. Portals of exit include the respiratory tract, GI tract, or skin breaks. Question 16. Which PPE is used for droplet precautions? N95 respirator. Surgical mask. Goggles only. No PPE needed. A surgical mask is sufficient for droplet precautions as particles are larger. Question 17. Which is a common sign of a localized infection? High fever, redness and swelling at the site, low blood pressure, confusion. Localized infections show signs at the specific site of injury or entry. Question 18. When handling soiled linens, you should shake them to remove crumbs, hold them close to your uniform, place them on the floor, hold them away from your body. Linens should be handled minimally and kept away from the uniform to prevent cross-contamination. Question 19. What is the primary purpose of reverse isolation? To protect the staff, to protect the environment, to protect a person with a weak immune system, to keep a resident from leaving. Reverse/protective isolation is used for immunocompromised patients. Question 20. Disinfection is the same as sterilization, the process of killing most, but not all, pathogens. Washing with plain water. Used only for surgical tools. Disinfection kills most pathogens but not necessarily all spores.